such as diabetes, hypertension, and mental health disorders after fleeing their homes due to their fears for their safety and threats to their livelihoods. The humanitarian organization says the priority is to ensure that those that are at risk continue to access essential healthcare services regardless of who they are or where they come from. For more on this, we are joined on the line by Claire Waterhouse, Doctors Without Borders Emergency Coordinator. Claire, good afternoon and thank you for joining us on Africa Update.
Hi, thanks so much for having me.
Now, Claire, MSF is responding to thousands of people who have been displaced. Now, brief us on what is happening on the ground and what the most urgent humanitarian and healthcare needs are.
Yeah, so what we're seeing is a pretty serious situation on the ground, building up to the 30th of June and post that arbitrary deadline set by anti-migrant groups. We have seen a lot of people both fleeing out of fear preemptively, but also having been chased away, intimidated, faced violence, faced threats at all levels of vulnerability. You know, we saw a woman who was pregnant, 2 months pregnant, who was beaten by a mob in her home and then was forced to flee with nothing. So the violence is quite deep and I think much more commonplace than many in South Africa are actually aware of, and it is also quite consistent. And what this is ending up with is just thousands of people who have been displaced, who are trying to leave the country, and they are gathering at points around the country. For example, there's a few different places in Johannesburg where people are gathering by the thousands, waiting for buses to take them to Musina and then out of the country. But that is taking time. And so what we are seeing is people sleeping outside in the middle of winter. Many of them do not have adequate clothing or blankets or shelter. They don't have access to clean water and sanitation. And many, as you mentioned, have chronic illnesses. They have not been able to access those medications for a while. Others are getting sick as a part of this. We're also seeing terrible mental health repercussions. The trauma that people have been through is really awful. And also those with existing mental health conditions. So, for example, we saw a patient last week who has a disorder that is diagnosed. She's been receiving medication, managing it well, but she was chased away from the clinic and unable to access her medication. Now she's fled, and she was suffering from really severe hallucinations and visions that were affecting, her very deeply and those around her. And luckily, we could connect her back to the medication, but that is one person among many, and we are really struggling to keep up with the amount of people who need medical care and support in this time.
And what challenges is MSF facing in delivering humanitarian assistance, particularly given that the number of people spread across different locations?
Yes, exactly. So people are spread all across different locations, and we have teams, but of course our teams are small and trying to deal with many things at once. And additionally, people are moving on very quickly. So within a few days, a patient that we saw may not be there still anymore when we come back with medication, or if we want to follow up psychologically and that kind of thing. So that does make it tricky for us. We have to be able to provide everything that's needed right there in the moment, which is not always possible just by default of the situation. And the same applies in Musina as well. Luckily, people are being processed there very quickly, from what we can understand, and being allowed to leave. But it does mean that we might be missing patients who are chronically ill and who need to see a doctor before they go across the border. We do have teams in other countries, so there's a team in Beitbridge also waiting to receive people and help them. But there are really serious concerns about healthcare disruption. There are a lot of pregnant women and babies in these groups, also very, very newborn babies. We've seen several mothers who are only 3 or 4 days post cesarean section having to flee with nothing, carrying their babies, trying to, the pain of a C-section scar, for those who know, is no joke. So we're very worried about follow-up care, about health disruptions in general for people who had been adhering. And it's very challenging in this environment to be able to provide care like that.
Claire, what more needs to be done by the government of South Africa and humanitarian agencies just to ensure the safety, dignity, and well-being of those affected?
Mm. Well, we need the South African government, but we need all the governments of people involved to step up. You know, we're seeing a lot of Malawians, a lot of Zimbabweans, other countries as well. Their governments also need to be doing the maximum that they can be doing alongside the South African government. We need the disaster management protocols of the provinces to be coming into place. And then, frankly, to be honest, we need all humanitarian actors to be stepping up. There are a lot of civil society organizations who are doing their best, you know, grassroots organizations, communities who've come together. But it is difficult because the sheer scale of it, and because volunteers can only do so much, you know, they also have lives and jobs and financial constraints. So we really do need that official support. And it's to benefit everyone. You know, even in Musina the other day, we saw patients who have active TB who were turned away from clinics and who now are showing drug resistance TB. So this is not just a problem of individual health. This is a problem of public health that needs to be addressed urgently.
Claire, thank you so much for joining us on Africa Update. We'll leave it there for today.
Thanks for having me.
That's Claire Waterhouse, Doctors Without Borders Emergency Coordinator, joining us on the line.
Africa Update.